Yeast infection, also commonly referred to as candidiasis, is an infection caused by the uncontrolled propagation of yeast, primarily of the Candida genus. Candida yeast exists harmlessly in your body, particularly the skin, and their growth is kept in check by the immune system and other microorganisms in the same area. The most common culprit is the Candida albicans species of yeast. These yeasts require moisture to grow and therefore prefer areas such as the mouth, armpits, nail beds and genitals, making these the areas where infection is most likely to occur. Candida infection isn't dangerous except when yeast enters the bloodstream and spreads to sensitive organs in the body. This condition is very common. In the course of your lifetime, you are bound to get at least one infection. Let's look into the most common signs and symptoms of yeast infection. Candidiasis can be broadly categorized as either superficial or invasive. The superficial varieties mainly affect the skin and mucous membrane and include oral, esophageal, vaginal, penis, skin and infant yeast infections. Some common symptoms of candidiasis include changes in mucous membrane, foul-smelling liquid discharges and irritation in affected areas. However, the symptoms tend to vary according to the type of infection one is suffering. Oral candidiasis can be identified by the presence of a yellow or green coating on the tongue and mouth known as thrush. Other symptoms may include discolored patches on the tongue and palate, red or pink blotches on the palate, as well as red cracks at the corners of the mouth. It is possible for oral candidiasis to spread down into the esophagus and pharynx, in which case you are likely to experience difficulty and pain when swallowing. Perhaps the most well-known and most common type of yeast infection is that which affects the vagina. Vaginal yeast infections, as suggested by the name, affect the female genitalia and are of course specific to women. It is a very common condition. In fact, 3 out of 4 women have it in varying degrees of severity in the course of their lifetimes. Symptoms include itching, a burning sensation, irritation, soreness and the presence of a white or grayish discharge with a fishy smell. It is a common misconception that men are not affected by genital yeast infection, but the truth is they are also susceptible. However, this condition is much rarer compared to its prevalence among women. Signs of male genitalia infection include redness around the head of the penis, itching, swelling and irritation of the head of the penis. These may also be accompanied by an unpleasant smell, pain during sex and urination, difficulty retracting the penis into the foreskin and a white discharge under the foreskin. In men it may also manifest itself around the crotch and feet. Common signs of male yeast infection include athlete's foot and jock itch. If you spend a lot of time with your hands in water, you may get candidiasis of the fingernails. It manifests as red, swollen areas around the nails and is accompanied by considerable pain. In more severe cases, it may lead to separation of fingernails, exposing a discolored nail bed. If you spend a lot of time with your hands in water, you may get candidiasis of the fingernails. It manifests as red, swollen areas around the nails and is accompanied by considerable pain. In more severe cases, it may lead to separation of fingernails, exposing a discolored nail bed. Infant yeast infection may occur in babies who are delivered or breastfed by infected mothers. You can detect infection on your baby by looking for red patches that look like diaper rashes. If the rash doesn't disappear within a week, this should give you sufficient cause for suspicion and you should have your child examined by a doctor. Candidemia is a condition in which yeast enters the bloodstream and precipitates a very serious condition, especially if it spreads to vital organs such as the heart. The mortality rate among patients with this condition is between 30% and 50%, though the opportunistic nature of the Candida yeast means that it mainly kills those with severe immune deficiency conditions such as AIDS. It is very rare among healthy people and deaths are even less common. Yeast infections can usually be treated at home successfully, Although you should be certain that you have a yeast infection and not a vaginal infection or other illness before you attempt to treat it yourself. Over-the-counter yeast infection creams are not always effective in treating yeast infections and can leave some resistant yeast behind. With the less resistant yeast out of the way, that leaves plenty of room for the resistant yeast to grow and thrive. Then, the next time that you get a yeast infection and attempt to use a cream to treat it, there will be even more resistant yeast than the first time around, and the cream will be even less effective. Because of this, overusing OTC yeast infection creams can lead to chronic, recurring yeast infections that become quite difficult to treat. If you are looking for a permanent cure for yeast infection that you can use at home, check out link in the description for a method of clearing up yeast infections in hours instead of days.